each individual patient is going to make their own story with MS. And it's important that the physician and multidisciplinary team that they have around them are able to personalize that approach to treatment. When I first greet them out in the lobby or see them in my exam room, you start to get an immediate flavor for what brought that person here, I would say. What's their story? And that's the most interesting part of the day-to-day, and the most important part of a physician-patient interaction, I think, is really getting to know that person. And you want to know what were they hoping to get out of the visit today. The goal of treating MS now is to not let it impact people's lives and not let them suffer the disability that patients in the past had. But it still means that we're following patients for a long period of time. The continuity of care in MS is one of the most satisfying aspects, I would say, is that we get to see people through all stages of life, really. I think of myself as having all of the resources of the Cleveland Clinic at my disposal. When they come in, they walk into the office and meet with me, I see myself as a link to everything that's around us. And I always ask myself the question, what tools could this patient benefit from? What should I link them with, and how can we make them better? How can we improve the way they're functioning in their day-to-day life? A lot of what I do is focused on work, but I have a young family, and my favorite thing to do is to spend time with my kids. And so one of the things that my kids and I have done for the last 3 years together is we actually build an ice rink in our backyard. And so yeah, we put up some little boards and we flood a tarp with water and let it freeze, and the kids can have friends over and we'll all ice skate and play hockey and stuff in the backyard. And that's one of the things that I think is kind of unique that we do that has made the winters around here more fun.